Once again, on the COVID merry-round, we are whipping around for the fourth or fifth time to enter a phase of the pandemic that feels ominous and scary. The good news is we are lucky enough to have at our disposal, free of charge, life-saving vaccines. I want you to show you this chart, which says more than anyone can say about this, okay? It shows how the UK's vaccine rollout has dramatically reduced deaths from COVID. It is a picture worth way more than 1,000 words. Okay, the UK's second COVID wave, that's the pre-vaccine one on the left side, right? On the left part of that, those are cases, and on the right, the deaths. And you see that sort of neat correlation, right, between cases on the left, deaths on the right. Okay, now look to the chart of the third wave. That's post-vaccine. That's in bluish gray. Look how much lower the death toll is, right? The cases, they grow, and what happens? The deaths barely budge. It seems the only real explanation we have here for the disparity in deaths are the vaccines. In the UK, nearly 70% of people are fully vaccinated. Now, compare that to here in the US, where only about half of the full population is fully vaccinated. Millions of children are still ineligible, of course, to receive the vaccine. So as you prepare to go back to school, parents are waking up to stories like this from the New York Times. 31 children test positive for coronavirus at summer camp. All 31 children who tested positive are under the age of 12, making them too young to receive vaccines in the US. Now, fortunately, none of those kids got seriously ill. But as we battle the highly contagious Delta variant, lots of parents are asking the question, how worried should you be about your kids who cannot get vaccinated if there's high levels of community transmission? And also, how worried should you be about breakthrough cases if you are vaccinated? Dr. Ashish Jha is the Dean of the School of Public Health at Brown University, and he joins me now. All right, Dr. Jha, let's start with folks that are listening that are vaccinated and wondering what should they make of the fact that we've got this spike in cases, a more transmissible variant, but they are vaccinated. What is their risk? How worried should they be? And how should their behavior maybe change or not change?
Yeah, great, Chris. Thanks for having me back. Those are great questions. Here's how I would think about it. Here's how I think about it for me, which is, first of all, I don't worry about getting super sick and dying anymore from this virus. And that is a huge relief. Second is that there is a chance that I might have a breakthrough infection. Because there's so much virus circulating in certain communities, particularly those communities with large surges, that we are going to see a lot of breakthrough infections. And breakthrough infections are pretty miserable. Some of them are very mild, by the way, but I've had colleagues who've had breakthrough infections, and they can be miserable. A couple of days of high fevers, cough, don't feel great. But again, you don't end up in the hospital, and that's the saving grace. And then the last big question that people worry about is, what about long COVID from breakthrough infections? And so far, the data says, and we have to be cautious and not overinterpret, that you don't necessarily, or your risk of getting long COVID is much lower if you've had a breakthrough infection after being vaccinated. Again, that's not a slam dunk. We're not 100% sure. So at this point, I would say if you're vaccinated, I would not worry excessively.
Yeah, so here's one way I've been thinking about it, and I wanted to bounce this off you because, again, I'm not an expert, but I've spent 16 or 17 months of my life on this show trying to beat out of people this idiotic, dangerous, toxic, and insidious talking point that, like, it's just like the flu. And it's like, no, it's not like the flu. The flu, we've lost 600,000 people to it. And yet, where I end up coming around back to is, if you're vaccinated, it's kind of like the flu. It might even be less dangerous than the flu, right? Like at the end, after vaccination, this talking point that was false, like the way you think about risks, the way you think about the illness, it's in the ballpark of the flu.
Yeah, it's hilarious in some ways. I don't mean to make light of this because it's a very serious condition. But in some ways, what we have done is turned the 2021 version of COVID, if you're vaccinated, into the 2020 version that all the misinformationists were claiming. Yes. And so I find myself saying things that I was spending all this time combating last year.
Yes. So that's well said. Let's talk about kids. My read of the data in the aggregate as someone who both have three children under 12 who can't be vaccinated, and I want them to be safe and not get sick. But my read on the data from the beginning is kids are relatively low risk. They've always been relatively low risk. You definitely don't want your kids to get sick if you can avoid it. But this is not a disease that has wildly elevated levels of hospitalization or mortality for children, even compared to things like, say, RSV, which is a fairly common respiratory infection for kids that, in fact, my youngest had and was terrifying when you're in the hospital for. What's your sort of top line here?
Yeah, my top line is, again, relatively low risk. I have a 9-year-old who has not been vaccinated, obviously. I would really prefer that he not get COVID. But at the end of the day, I don't spend a ton of time worrying about it, because if he were to get it, and we're going to try to do everything we can to protect him, but if he were to get it, he'd probably do just fine. Some kids have gotten really sick of this virus, but we should protect them.
Yeah.
But we shouldn't spend a ton of time worried about how to protect relatively young children who do pretty well from this virus.
So the final question here is on masking. And I think my own personal feeling has changed a little bit, just at the base rate of community transmission. So, I was kind of enjoying the supermarket shopping without masking. I don't really like wearing a mask. It fogs up my glasses and it really annoys me. I think I'm kind of back to masking in big indoor public spaces, just because it seems that the level of community transmission means that, like, why not take the extra step? Where are you at?
Yeah, I'm very similarly. I'll tell you two different things. I'm in Massachusetts, is where I live, and I'll pop into a Dunkin' Donuts and pick up a cup of coffee for 2 minutes, and I'm okay without a mask. If I'm going to spend 45 minutes grocery shopping, I probably will put it on, because infection numbers are rising. Last week I was in LA, and I was masked up indoors every time I went indoors, because the infection numbers were much higher. So a little bit of this depends on context. A little bit of this depends on, I just don't want a breakthrough infection. I think it's reasonable to make different decisions based on where you are.
Yeah, I think that's really good advice. And yeah, like, if you don't mind wearing a mask, and like there's a lot of community transmission, like, it's not the worst thing. Dr. Ashish Jha, that was very, very, very illuminating and clarifying. It's always great to talk to you on this stuff. Thank you.
Thanks, Chris.